So for today's question, we will talk about the antibiotics. So the antibiotics, as we all know, there's drugs that to help the body kill the bacteria when it's sick. So the two questions for today. The first one, how would an economist classify antibiotics use? And the second one, public health officials are considered with overuse of antibiotics, which leads bacteria being resistant of antibiotics. What is the solution to this problem? So the first one, I think the classification of antibiotics by economics is public resources. This is resources in the world is useful to humans, but needs to be controlled because of drugs resistance. And this is all the common resources concept. And for second one, I think the solution is rise the price of antibiotics. The cost of antibiotics should include the cost of drugs, the cost of side effects, and the hidden cost of bacterial resistance. The high price will lead to a significant cost associated with abuse antibiotics. Patients and doctors will be more careful in choosing drugs, and more consideration will be given to the use of non-antibiotics drugs and alternative therapies. The use of antibiotics not only has individual responsibility but also social responsibility. A patient on reasonable use antibiotics not only affect himself, also for society. So with exterminators raising the price of antibiotics also amounts to a tax on the externalities of antibiotics use.